Hi, welcome to the channel. Today we're doing questions and answers. Rapid fire, you ask, I answer. I have half a dozen questions loaded up here, so let's get started. How important is it when you have diabetes in pregnancy to test exactly 2 hours after meals? The answer is fairly important. So when you eat a meal, whether you're diabetic or not, your glucose starts to go up the minute you start eating, and it peaks usually around an hour after you eat and then starts to come down. So by testing 2 hours after you start a meal, we know where your glucose ought to be. So if you're testing 30 minutes before or 30 minutes later, your value is going to be higher or lower, and we don't know if that's going to be normal or not. So another important point about testing 2 hours after each meal is that you're timing this from the beginning of the meal, not the end of the meal. So set your alarm on your phone the minute you sit down to eat, and it's 2 hours from that first bite. And it should be less than 120 2 hours after meals. Everywhere I read, it says I should be eating low fat, but that's not the way it is for most diabetic meal plans. We've been told since the 1980s that we should be eating low fat and that that's the way to maintain our weight and to avoid a lot of weight gain in pregnancy. But the truth is that Americans have actually eaten a lot less fat over the last 20, 30, 40 years, but obesity rates have skyrocketed. So clearly low-fat eating is not the most healthy way to eat, or at least it's not the only thing that's important. When you have diabetes, counting fat grams or counting calories is not as important as counting carbohydrates and carbohydrate calories, because those are the components of your meals that make your blood sugars go up. So don't worry so much about fat. Fat can be very healthy in pregnancy. Think about nuts, eggs, avocados, peanut butter. Those are pretty healthy options for you, and they're all fairly low carb, so they're not going to affect your blood sugars much. So don't worry so much about low fat. Focus more on lower carb and lower starch, and find the balance that works for you. Dairy, yes or no? Well, there's not a simple answer to that. I know that there are plenty of websites involving diabetes that will say never eat dairy, and then there are some that say dairy is perfect, eat a lot of that. What's a person to do? Well, see for yourself is the answer. In general, you don't need to drink anything less than 2%. If you're a skim milk drinker, that's fine. When you're talking about dairy, it's not the dairy that is going to make or break you in terms of blood sugars, but it's added sugar. So when you look at yogurt, for instance, in the grocery store, most of it is low fat or fat-free. So I would look for whole milk varieties because they generally have less sugar. But most yogurts have a ton of added sugar, and the fruit or the Fruit Loops or all the granola that's on the top, these are things that you generally don't need unless they have a lot of fiber. So go ahead and try dairy, see how it works as part of your diabetic meal plan, and just check your glucoses, and you may have to adjust from 1 cup to half a cup, or you may find that you can drink even more. So the answer is you're going to have to see for yourself. Just make sure there's not a lot of added sugar. Should I be counting calories? Oh, maybe, but it's not super important. The way you eat for diabetes is to count carbohydrates more than anything else. And your calorie count is not going to play a big role. Fat, for instance, which we encourage you to eat in pregnancy and especially with gestational diabetes, has a lot of calories, 9 calories per gram, as opposed to proteins and carbohydrates, which have about 4 calories per gram. So sometimes if you look at how many calories you may be eating, you can freak yourself out, but not to worry, because these fat grams are helping keep your glucoses under better control, especially when, like we talk about in another video, you eat your protein or your fat first before your carbohydrates. So count the carbohydrate grams, and depending on what kind of diet that you're on, you may find that you can have 20 grams of carbohydrate per meal. Other people can handle more like 40 or 60 grams per meal. This is where the trial and error part of your experiment comes in. So make sure that you have a healthy balance of fat and carbohydrates and protein in your meal, and then just see how your glucoses do. If they're a little bit high, try adjusting up for protein or down for the carbohydrates. Sometimes it's not a matter of subtracting something, it's a matter of adding something better. You shouldn't be hungry on this diet. Remember, you should be satisfied and stay full even in between meals. Does COVID infection affect blood sugars? It sure does, and in several ways. So whenever you have any kind of infection, whether it's strep throat or a cold or a sinus problem or COVID, any kind of infection can make your blood sugars go up when you're sick, especially if you have a fever. When you have COVID, in particular, the medicines that we use to treat COVID infections can sometimes make your blood sugars go up. Dexamethasone, which is a steroid, is part of the treatment regimen that we use for many patients who are hospitalized with COVID. And steroids make your blood sugars go up. This is a temporary effect, and the infection is temporary also. So if you find that your glucoses have bumped up a little bit, most of the time you don't need to do anything different except maybe lower your carbohydrates and increase your protein and fiber until you feel better. But your doctor may decide to put you on a low dose of some insulin or metformin or a medication to help keep your glucoses under control. Remember, this is usually temporary, and when you begin to feel better, the medicine can be lowered or discontinued. Man, that was a lot of fun. I love questions and answers, so send me your questions and I will try to answer them in an upcoming video. Don't forget to subscribe and turn on your notifications so that you can get new information that I hope is helpful every single week. And if you have diabetes in pregnancy, whether it's gestational diabetes or type 1 or type 2 diabetes, I have a brand new course that you should check out. It's called Conquering Diabetes in Pregnancy. We talk about how to eat, what to eat, when to eat, how to combine foods so that your blood glucoses are in their optimal range, how to find exercises that you can do that are fun and easy in pregnancy. Lots of information to answer all your questions. It's at courses.drtracypapa.com or click on the link below.